Our final speaker, and only because she's going to wrap it all up in there, is Carmen Parter. Now, Carmen's an adjunct associate professor here at University of Sydney, and she'll be talking about falling on deaf ears, a public policy perspective in her presentation, and it's really looking at her whole background as a bureaucrat before she became, had an academic leaning now and doing a PhD, and so she'll be looking at it, from the areas of health, law and justice, child protection, and really trying to give us some insights into the impacts. And as you've seen, the transition we've had, from Kelvin's presentation to Sam's to Dennis's, and now Carmen's is really leading us along a little journey, which we'll hopefully be able to draw in a little bit about what ScoMo, as he likes to be affectionately known as, is saying in the public area of Indigenous affairs. And, I think it would be remiss if we didn't recognise our first Minister for Indigenous Australians, Ken Wyatt, who had a very stellar background as the Minister for Aboriginal Health, and which we sorely miss. But, he's going to have the challenges in his new role, and I'm sure that Carmen will tell us all about that. And she'll give a little summation at the end. Okay, thank you. Carmen.
Morning everyone, how are you? Just let me get myself organised here. I'll just begin by acknowledging country, the Gadigal people of the Eora Nation that we're gathering on today, and similarly pay my respects to elders, both past and present, and for those that are emerging. I'm a proud descendant of the Durrumbal and Jura clans of the Birragubba Nation, a nation in Queensland. I've grown up here in New South Wales for most of my life. I similarly have South Sea Island heritage from the island of the Tanna Island in the Republic of Vanuatu. So as Tom alluded to, I actually do have several years, well over 25 years, working in the bureaucracy and working in particular on Aboriginal and Torres Strait Islander health. In fact, in my early years, I was around when they introduced media strategy in New South Wales. So there are some very familiar faces in the audience, and Sam's one of them as well, that we were around at that time when I was a junior policy officer helping implement that particular initiative. And, even then that was a case in time where we recognised that otitis media was quite a significant issue and it needed to be addressed. I left the health department not long after, but during my time that I left, unfortunately, that program did cease, and for whatever reasons, not quite that familiar with, but when I returned, there was another quite a significant issue, strategy in place around ear health and taking a public health approach. And a lot of the conversations that you've heard this morning from my colleagues on the panel is very consistent to what that particular strategy was talking about. On another note, I'm actually one of the 6,000 people that you service here in Australia, adults, and I'm meant to be wearing hearing aids, but I suffer from so you might have to yell at me. But when you ask really tough questions, I think a bit of selective hearing might come into play. So I'm one of those people that grew up with otitis media and suffer significantly chronic suppurative otitis media in my older age. I should say senior age. But look, can I just thank my colleagues on the panel this morning, because really you gave a really in-depth and comprehensive picture of the challenges that beset us as practitioners in this space and as policymakers in this space. And we saw the examples from a clinician's experience and the challenges there around the fragmented service platforms that are in, right across the state, and we heard about some solutions around that, and in particular having consistent national focus on what needs to occur right across Australia. And similarly, Samantha's talk just further demonstrated those complexities and in particular, the many layers that need to be addressed and the many relationships that occur within this particular issue around ear health and otitis media. And thank you both to Kelvin and Dennis for introducing, issues around the knowledges that play out into this space in regards to our communities. I really loved it, Kelvin, how you brought in the story first, because, stories and the way that Aboriginal and Torres Strait Islander communicate and how our knowledges are passed down are critical, and that beautiful film just demonstrated once again the challenges that we face in addressing this particular issue. And Dennis, I thank you so much that you actually spoke about the different ways of being and knowing and doing that is part of our culture and who we are as people. And I deliberately chose this metaphor because, let's face it, I mean, I've been around too long, and otitis media has been a critical issue, and it's seen as a crisis in our community, but yet there's the challenge of addressing it is not happening, and so that's why I chose Falling on Deaf Ears, and in particular that gift, because once again our children and our families are being held at ransom around this particular challenging issue. But similarly, I mean, the other critical point that I need to make here is that our voices are not being heard, and in particular our ways of being, knowing and doing aren't being privileged in a public policy space. And my years of experience in the public sector have indicated that, and now I get the chance to sit back and think about this. And so today I just want to quickly present some of my thinking around not the relevance of, but rather the central positioning of our knowledges and our cultural ways of being known in public policy context. So in doing that, let me begin. So exploring Indigenous knowledge in public policy has been a long-standing pursuit of mine, but in more recent times, it relates to my PhD in regards to responding to a question that I've asked. When the culture of Indigenous Australians has been incorporated into a public health policy like the Australian Government's National Aboriginal and Torres Strait Islander Health Plan, which you've already heard about, how do policymakers enable, embed and this interest, as I've mentioned, follows on from a lengthy career in the policy ranks of governments, and including an earlier piece of work about the need for a culture in the policy development cycle. Oh my God, it's already been 6 minutes. This earlier work attempts to provide solutions to a problem encountered in a policy area of government. And in particular, the devaluing and dismissal of our cultures and our knowledges. I argue that Indigenous knowledges of our ways, our cultural ways of being, cultural ways of knowing, and cultural ways of doing is relevant in a public health response to such wicked issues as otitis media. So without that knowledge, you're not going to address anything. I'll have to quickly cut this thing. Sorry, I should add that on first. Is that actually the slide?
Yeah, unfortunately, full screen because.
Oh, okay then. All right. So our knowledge is in our ways of doing and knowing, being and knowing and doing is critical. And what I also argue is that, so I've just really lost my place now. So I argue that Indigenous knowledge of our cultural ways of being, cultural ways of knowing and cultural ways of doing is relevant to public health. If real transformational change in the health status of Indigenous Australians is to be, then our knowledges and cultures must be front and centre. Unfortunately, the knowledges and cultures held by Indigenous Australians are not fully acknowledged or recognised and often dismissed as irrelevant. For far too long, scientific, Western scientific and biomedical knowledges of ways of being, knowing and doing have dominated and informed public health policies, programs and services. And I've done this diagram because the critical about this diagram is that what we need to acknowledge is that our knowledges count. And furthermore, what I'm not saying is that Western science and ways of knowing and being can complement our knowledges. And our knowledges need to be front and centre, including our cultural ways of being, knowing and doing. And I wrote specifically about the cultural infusion well over 10 years ago, and I offer this concept of a cultural infusion. And the critical point about cultural infusion is that the knowledges that meet in that intercultural space is equally important, and one should never ever dominate the other. Presently, our knowledges around that we hold as Aboriginal and Torres Strait Islander people are dominated usually by the many other knowledges that meet in that intercultural space. So what needs to happen? And I think my policy colleague, when he was around at the time, Houston, said, we need to shift from a program of low expectation and to approach that reinvents organisations and transforms structures, systems, technologies and processes to provide the change that transforms the culture of organisations, professions and the workforce and the relationship across societal silos. We need change that reshapes public policy, including financing, including accountabilities. And these same sentiments were shared at the National Aboriginal and Torres Strait Islander Health Summit held in Sydney, where Dr. Greg Richardson actually said, you know, we need to change the paradigm in the system changes, but fundamental to that is our knowledges and cultural ways of being, knowing and doing. So the change of reinventing institutions, structure, systems and practice requires a revolution that challenges the dominance of scientific Western and biomedical knowledges, which have been similarly driving the closing the gap agenda in recent years. Fundamentally, we need to overhaul the Indigenous public health policy discourse and processes, and we need to draw on the strength of community, and we need to change the conversation from a deficit-based approach. And in doing that, that is about building on our knowledge and our cultural ways of being, doing and knowing. So, in thinking about this, I offer, I've been thinking about this for a while and looked at system thinking always resonated with me. And when I was working in the public policy arena back in New South Wales Health, I started to think about why is it that we don't, given the investment that's going in Aboriginal and Torres Strait Islander health, why are we seeing the changes that we really need to see? And a couple of significant issues in Aboriginal, when I was in Aboriginal health, was the New South Wales Aboriginal Health Plan and the 6 new actions in the National Safety and Quality Health Services Standards, which went into effect January this year. My colleague Braden helped us do the significant consultation about that. But people wouldn't realise that really underpinning those significant initiatives, and particularly the safety and quality health services standards, with my colleagues from the National Aboriginal and Torres Strait Islander Health Standing Committee of RMAC, was the concepts of system thinking. And when I was looking at doing this presentation, I actually come back from the work of Jilham, Scoobert and her other colleagues there around using system thinking, and in particular the intervention level framework of understanding the complexity associated with the Titus media. And I found this a really useful paper, and so I encourage us to read that at a later date, but certainly it resonated with me, and for two reasons. The first reason is that the things that they spoke about in that particular framework we were encountering in New South Wales when it came to trying to address the Titus media and implementing the ear health program. So, for example, we heard about the lack of data and being able to have that data to help inform decisions. And that was relating to number two there, the knowledge, feedback and delays. So making sure that you've got that data in place to collect the information that you need to collect. And this particular evaluation said that, where there were clinics, it actually, there was a demonstration that there was a reduction on Titus media, but what failed was a statewide data collection system that would enable you to take a population health approach to determining whether the activities that you're doing is actually working. And similarly, you know, this study also identified a range of structural elements that needed to place to effect paradigm shifts. Now, the paradigm shift is quite difficult to achieve. And as you go from 5, 4, 3, 2, 1, the one is the really easy things to achieve. But if you can change the paradigm, there's apparently quite significant effectiveness. So when I mentioned the National Safety and Quality Health Services standards and the 6 new actions, they're really the structural elements that I speak about when it comes to putting in place those actions within organisations. But ultimately, you're going to achieve the paradigm shift because of those 6 new actions. And that's why I really like that framework. But I will, again, I would make a strong stance that these are great scientific Western models of practices. They do come from a different way of understanding and knowing and being. But critical to that is that you have to and you must, it is an imperative that our knowledges and our cultural ways of being and knowing is front and centre of everything that you do. And at the moment, the systems don't allow that to happen. So I'm arguing that this is actually a worthwhile framework, but critical to that framework is our knowledges and cultures. And I just want to conclude by acknowledging my team, but also, you know, open your ears and listen to our ways of knowing, being and doing. Thank you.
Thank you, Carmen. So, questions, comments? Yep.
Thank you. My name's Rodney Adams and I work for the University of Newcastle. I also teach Auslan and Deaf Studies. So when you talk about Indigenous knowledge and ways of being, I always think about what was it that was involved in our languages before the impacts of colonisation. And one aspect of that would be the Indigenous sign languages. Because I teach at the university, my field is sign languages, and we especially look at language deprivation. I notice a lot of these topics are on hearing loss, but what about like language deprivation? So I work as a teacher of the deaf with Aboriginal and Torres Strait kids, and language deprivation is a massive issue, as it is with the general deaf population. Looking at technology, as we've talked about this morning, is good, but it's not the solution. It's only a supplement to how we learn languages. And from my perspective, learning a language or having the ability to function appropriately in wherever we are, whether it's school, work or whatever, we need good language acquisition. So my focus, if I ever get around to doing a PhD, would be the revitalisation of Indigenous sign languages, because I think if we can connect that with the social and emotional well-being, as it is with Indigenous spoken languages, and how empowering that is, I think it would do a lot of good with our deaf and hard of hearing Indigenous population as well. So I'm just wondering, in the scheme of all those things, is there a place for that type of Indigenous sign languages to empower our deaf and hard of hearing Indigenous populations in the future?
Invite others to comment, but our languages is fundamental. It contains our laws, L-O-R-E. And I think community are very strong that our languages are critical to reconnect us to our cultures and the knowledges that have been taken from us, you know, due to the colonisation process. So yes, in New South Wales, they legislated, you know, they used a policy instrument to legislate the reinvigoration of our languages. And it's probably a really good case study to look at how you use a policy instrument in terms of being able to do that. Maybe that's one thing I'll do later on.
Yeah, we can pick up that, I think, when we get onto the panel in a few minutes. Right.
Hi, Carmen. Thank you. Braden Abala, West Local Health District. Thank you for mentioning the 6 new standards that are in Australia. I think that they represent a really fantastic tool or leverage opportunity to face. I guess the issue is with the burden of disease in Aboriginal and Torres Strait Islander communities, where do we focus that energy? Because one of those standards says that you will create a strategy or policies that are responsive to the needs of the Aboriginal. So do we try to gather all of the different burdens of disease and figure out if there is not a golden bullet or a silver bullet or something like that, but you know, a set of things that we should be working on as a beginning in this space? I don't know.
I think this might be the time to have a bit of selective hearing. I think that's a great question, Braden. Thank you. I think the critical thing about those 6 new actions is making sure that Aboriginal and Torres Strait Islander people are front and centre again, you know, to address those things, because in fact they actually have the solutions. I don't think I can firmly answer your question, but happy to talk about it as a panel or a total conversation in the room.
That's a good segue into convening the panel, but can we thank Carmen, please, for her presentation?